Well, let's get the latest on COVID-19. It is California's big reopening day, and Dr. Ernst von Schwartz back with us this morning. Thanks for joining us again, sir. Where do we stand now? It seems like we are, especially in California, doing pretty well in this pandemic.
We do, actually. Good morning, Joe. I mean, in the hospitals, we hardly see any COVID patients anymore, fortunately. California, as you know, is a state with the highest number of vaccinations. Approximately 50% of the people are vaccinated now in California. And I think as a result of that, we see also the lowest number of new cases right now compared to other states. So we all are welcoming, of course, the opening today.
Yeah, it is good news. And when we see mask mandates going away for people that are fully vaccinated, what is that going to mean for folks if you're walking out today and going to a grocery store? Is that something that obviously we're not going to have to worry about anymore?
Well, I mean, the changes were implemented now basically for people who either recovered from COVID or are vaccinated. So they don't have to wear masks. Mm-hmm. The unvaccinated people still should wear masks. But the question is, how do you really can control that? And in addition, certain businesses like restaurants and bars can impose mask mandates, but that's an individual decision.
Right.
Overall, I think even if you look outside now in Orange County or in the LA area, most people don't wear masks outside anymore, and in several businesses, they don't. In the hospitals, however, where we are every day, of course, we do require masks for every patient contact, even for the visitors who come to visit their relatives.
Yeah, it certainly makes sense, especially in a hospital, and I know airplanes and public transportation as well. All right, let's talk vaccines. You mentioned California, one of the top states, the top state in vaccine effectiveness, getting people to go and take the shot. There is this thing that's popped up with some, I guess, younger men with heart inflammation. You being a cardiologist, maybe can explain it better. What is happening with some of these small cases, and is it something that people should be concerned about?
A couple of cases of what is called myocarditis, which is an inflammation of the heart muscle. And there's different causes for that. We know viruses can cause it, including coronavirus, but even vaccinations can cause it. So we have seen, as far as I know, approximately 18 to 20 people in certain states in the US now, out of course, several million who had received the vaccination. It's a very small number, but it is an inflammation of the heart muscle, which leads oftentimes to chest pain, sometimes fatigue, sometimes shortness of breath. It needs to be recognized early and treated. Those patients need to be monitored closely. In most cases, however, they heal out completely without further worsening of cardiac function or need for therapy, but we have to be aware of that as a potential complication of vaccinations.
And it's something really interesting that you and I have chatted about is a possible therapy for those that have been suffering with COVID, even people that are maybe long haulers who have had these symptoms for many, many months, and that's nitric oxide. Explain that for us.
Well, nitric oxide, thanks for bringing that up, Joe, by the way, is nothing new. We know that substance since almost 30 years now. It's actually a gas which we make, meaning our body. Our cells make nitric oxide. And nitric oxide leads to a dilation and opening of the blood vessels. And one of the reasons why we do age is actually because our blood vessels lose the elasticity, meaning they become stiff. And if you become stiff, that affects the oxygen supply to our organs. So nitric oxide is a gas, and we use that as an inhaled substance, often together with oxygen in certain conditions. It keeps the blood vessels elastic. It lowers the blood pressure. It lowers in particular the pressures in the pulmonary system. And interestingly enough, if used in patients who were suffering from COVID with respiratory illness and failure in the intensive care units on ventilator, we saw some benefits. And it's used as an inhaled gas, basically, but we even have now a lozenge available, which people can swallow for different reasons, you know. So it keeps the blood vessels somewhat young and elastic.
Interesting, and may help people that have been suffering with these symptoms of coronavirus. Dr. von Schwartz, thanks. It's always good to talk to you, and we will check in with you in a week or so and find out how we're looking then after California's been open for a little bit. Thanks for joining us.
Thank you very much.